The age of one-size-fits-all nutrition is coming to a close, and not a moment too soon. For decades, we've treated vitamins and minerals as universally beneficial, harmless in excess, and appropriate for nearly everyone. Grocery store aisles overflow with fortified foods. Pharmacies offer towering racks of multivitamins labeled for men, women, seniors, children, and pets. Online influencers recommend megadoses of B12, folic acid, vitamin D, niacin, and more, without ever asking about your diet, your blood work, or your actual biochemical needs. It's marketed as prevention, but in reality, it's blindfolded intervention. And as growing research now makes painfully clear, blanket supplementation isn't just ineffective, it can be harmful. This isn't a case against vitamins. It's a case against nutritional guessing games. Because what we're doing now, taking high-dose supplements without medical oversight, stacking fortified foods on top of multivitamins, assuming that more nutrients always equals better health, isn't science. It's superstition with a label. We now know that nutrient needs vary dramatically based on age, sex, genetics, health status, medications, gut microbiome, and even lifestyle factors like alcohol use or stress levels. Someone with a methylation defect, such as an MTHFR polymorphism, processes folic acid differently than someone without. A person with early-stage kidney disease can accumulate fat-soluble vitamins like A and D to toxic levels much faster than someone with perfect renal function. An athlete may require more B vitamins due to high metabolic turnover, while a sedentary person eating a fortified diet may already be at risk for nutrient overload, not deficiency. And yet we hand out the same products to everyone without screening, dose adjustments, or biochemical monitoring. Imagine giving the same medication to every patient regardless of age, weight, diagnosis, or organ function. Doctors would be sued into extinction. But somehow, this logic doesn't apply to over-the-counter supplements. The consequences are real. Large cohort studies have shown that excessive intake of folic acid, B6, and niacin can increase inflammation, impair vascular function, and even raise the risk of certain cancers and stroke, especially when baseline nutrient levels are already adequate. In older adults, high-dose folic acid has been shown to mask B12 deficiency, leading to irreversible neurological damage. Niacin, when taken in high doses without clinical supervision, can elevate liver enzymes, produce pro-inflammatory metabolites like 4-PY, and increase the risk of insulin resistance, gout, and cerebrovascular events. These aren't rare complications, they're predictable outcomes of chronic excess. And still, most people have never had a micronutrient blood panel. They've never tested their homocysteine, methylmalonic acid, or serum B12 levels. They're taking B-complex because they feel tired, vitamin D because they saw a podcast, or a daily multivitamin just in case. But just in case is not a reason to dose a biological system. It's an excuse for not asking the harder question: what does your body actually need? Personalized nutrition isn't just a trend, it's the only approach that makes biological sense. It starts with a detailed health history, a dietary analysis, and targeted blood work. From there, a qualified clinician can determine whether a supplement is needed, and if so, what form, what dose, and for how long. Maybe you don't need folic acid, but L-methylfolate. Maybe your fatigue isn't from low B12, but from anemia, poor sleep, or adrenal dysfunction. Maybe your inflammation isn't from a vitamin deficiency at all, but from excess vitamins choking your methylation cycle. Precision also means knowing when not to supplement. If your niacin levels are fine, there's no reason to take more. If your folate is already high from fortified grains, that gummy multivitamin might be pushing you past safe limits. Supplements aren't candy. They're bioactive compounds that alter gene expression, enzyme activity, and immune responses. That's a good thing when they're needed. It's a problem when they're not. The supplement industry is largely unregulated. Labels can be misleading, dosages are often exaggerated, and interactions with medications or other nutrients are rarely disclosed. And because the effects of nutrient overload are often slow and silent, many people don't realize the damage is being done until years later, when it's harder to reverse. So what's the answer? Less guessing, more testing, personalized plans based on actual data. Supplementation should be therapeutic, not recreational, used with the same caution and respect we give to pharmaceuticals. It should be driven by need, not marketing. And most of all, it should be flexible because your needs change with age, stress, illness, and recovery. In the end, true health doesn't come from maxing out every vitamin on a label. It comes from balance, of nutrients, of expectations, and of biology itself. The era of nutritional precision is here. It's time to trade in the just-in-case pill box for a smarter, safer, and more scientific way forward.